Well, I made this review for a very special occasion, the Third Congress of Southeastern European Pediatric Gastroenterology, SEPEC, in Belgrade in October 2013. I concentrated on one probiotic species, practically we can say one probiotic strain, which clinical efficacy has been extensively studied in children with functional gastrointestinal disorders. It could be said that it is one of the most studied probiotics, if not the most studied probiotic of all, for this particular group of clinical conditions. Pediatricians' functional gastrointestinal disorders represent a major issue of their everyday practice. It's important to understand why a specific probiotic strain can affect functional gastrointestinal disorders. But for clinical practice, the most important thing to know is, does it really works in practice? Therefore, in my opinion as a clinical doctor, the most important are the results of high-quality clinical trials performed with this strain. And there is very strong clinical evidence of the efficacy of two Lactobacillus reuteri strains, commercially called Protectis, for prevention and treatment of some of the most common functional gastrointestinal disorders, particularly in infants and small children. Several double-blind, placebo-controlled studies were performed by the research groups of Savino and colleagues and Indrio and colleagues, with some additional trials done by some other researchers. They practically uniformly demonstrated that application of appropriate daily dose of L-reuteri significantly decreased infantile colics measured as daily crying time in compare with placebo, or even with simeticone, a drug traditionally used for the treatment of colics. When given for prophylaxis, it significantly decreased the incidence of colics in infants. Moreover, the researchers of physiologic effects revealed that applications of Lactobacillus reuteri enhances gastric motility, with lowering the emptying time of the stomach, that results in decrease of infants' regurgitation and better tolerance to oral feedings. This is also probably a mechanism why L-reuteri affects constipation. Well, I'm very proud to say that several experts that were present at the CPEC Congress in Belgrade, where I first presented this review, subsequently told me that they found my review not only very comprehensive, but also very systematic and objective. And that my colleagues from clinical medicine, majority of them not being special experts in probiotics, admitted that it gave them very valuable information for making their therapeutical decisions in everyday practice. Are you interested if I prescribe Lactobacillus reuteri to my patients? Well, certainly, especially for infants with colics and sometimes with constipation and regurgitation or even with functional abdominal pain. Does it work? Well, majority of parents tell that symptoms ameliorate after the use of this probiotic. The decision about prescribing a specific probiotic for a specific clinical problem must always be based on the firm scientific evidence. So my clinical work is based on facts and not on beliefs.